every different individual's experience on the spectrum is their experience, right? And then
Yeah.
their needs are their needs. And like I, mentioned, there's a reason why there's the diagnosis to begin with, no matter where they fall on the spectrum.
My name is Nancy Marchese. I'm a board certified doctoral level behavior analyst and a clinical psychologist. My goal is to help 2 million children with autism and their families by transforming their lives, and I can't wait to help you too.
It's important to have these conversations, conversations that you're sharing, your experiences, and to talk about the reality of this. And why I feel that it's important. There's a number of different reasons, but for me as a clinician, one of the reasons is okay, because if we can have these real conversations about these experiences and what matters for Ava, for Amy as mom, and the greater community, it means that we can then be in a position to do something to empower Ava, to empower you as a family. If it's not in the textbook, this is a great example. Or if you're in your medical program and you guys aren't talking about the realness of the entire spectrum, but only a sliver of the spectrum, then how can you possibly help people in healthcare who have the different needs, right? And so to be able to bring that to light through your experiences is so important for people to hear. Because what are we going to do about it? If we don't even know it exists, if we can't even have the conversation about these needs and about these experiences, how are we going to be in a position to do something about it? So your story is so important for people to hear and understand, and for parents who are living it themselves to know that they're not alone is really important. A piece of that story is the education that you've gone through yourself for your career and your profession. How has that shaped you in terms of the perspective that you bring, having Ava in your life, and where do you see healthcare in terms of where it can be done better for individuals on the spectrum? What can we do better in terms of healthcare, servicing individuals with a variety of needs, including complex needs? What do we need to do?
Well, first of all, I'm sure anybody who has a child with autism, regardless of the level, realizes what a barrier there is to services in healthcare. And upon going to school, my textbooks have such old, outdated information. And I'm learning from the newest textbook, the only textbook that exists for my program in the country. So anyone going through my program is learning the same outdated knowledge, and that's a problem. So I wrote to the publisher. I complained to my MPP because it's a government-funded program. I mean, we're creating a bigger problem because we're teaching people who are going to be working in the healthcare field inaccurate information. So we're just making a bigger problem worse. So to me, that's a problem. We could start with teaching accurate material.
There's only so much we could cover in the short amount of time we had today. If you found value in what we talked about, go to breakthroughautism.ca, join our newsletter, and also follow me on my socials.